Greetings for whatever time of the day it is in your part of the world, and welcome to the 9th call in the COVID preparedness series. This is the second call where we are looking at vaccine preparedness and rollout. And I'm Gunjan Veda from the Movement for Community-Led Development. I will be facilitating today's call with Nellie Mecklenburg from the Institute of State Effectiveness. For those of you who've been on our calls before, you already know some of the logistics, but I'm going to very quickly run through a few of them. So the chat is your best friend throughout this call. Please use it to introduce yourselves. It's very nice to know who is in the room. It's very nice to make these connections, and we've seen in the past how on these calls connections have been made and partnerships have been forged. So please do introduce yourselves in the chat box. We come back to our usual format in today's call, which is that we have a lot of breakout groups and discussions going on. Feel free to introduce yourselves, ask questions, put in your comments into the chat box so that we can all learn from each other, which is the spirit of these calls. The Movement for Community-Led Development is a group. Okay, thank you, Sarah. So for those of you who are new, the Movement for Community-Led Development is a consortia of over 70 INGOs and thousands of local civil society organizations from around the world who believe that every person has a right to voice in decisions that affect their lives. So we were formed the same day that the Sustainable Development Goals were announced at the UN. We started these calls in April this year, really because we kept hearing from a number of our partners about the kind of difficulties they were facing when the pandemic and the world went into lockdown. And since then, we have moved through a series of different topics and issues that concern all of us, from trust in communities and re-entry to, access issues and how do we work through our programming during those times to actually doing scenario planning exercises. And then in our last call, we actually started looking at the question of vaccine preparedness and rollout because we realized that that was a major concern that a lot of our members were facing. And we kept hearing them in these COVID calls about, do we have enough information? How is there going to be equitable access? How do we know that it's safe so that we can even advocate this to the communities? What is our role in all of this? Do we even know what our governments are planning? How can we be effective partners? How can we ensure that community concerns are taken to the tables where these policies around vaccine rollouts are being drafted? So last week, for those of you who were there, you would have seen that we had a high-level delegation from the World Health Organization, along with colleagues from Save the Children and the People's Vaccine Campaign, who shared with us, information around vaccine safety, around this whole process of vaccine decision making. At what stage does the WHO decide? How do they decide things are safe? How do we access this information? What is the rollout plan going to be like? The COVAX facilities. So we heard all about that. If you would like the recording as well as the answers from WHO for questions that we were not able to take in the call are all on the website, along with key takeaways and their PowerPoint presentation. We also delved a little bit last time into issues of access and the engagement mechanisms that exist for civil society organizations. Because one of the things that we keep hearing, and the WHO people mentioned this last time as well, was that, we recognize that we really need to work with civil society. We recognize that we are not going to be the ones on the ground, and neither are governments going to have that kind of presence. So we definitely need civil society, but we really don't know how to engage and who is civil society. And it's so difficult. And that's been one of the challenges. So what we are trying to do through that call and through today's call is to share a little bit more information about some of these mechanisms that do exist so that we are able to partner with them, engage with them, and make sure that what we hear in the communities reaches these tables, policy-making, decision-making tables. We were supposed to have a representative, and in fact, a delegation from the African Union Center for Disease Control today to talk about the AU engagement mechanisms for civil society. Unfortunately, they had to drop out at the last minute, but we will still share with them the information that we've heard from them about these different mechanisms that exist. Sarah, can we go to the next slide, please? So today's call, like I said, last call, we kind of focused on this whole structure of vaccine decision making. We focused on information around safety and viability of vaccines. And we talked a little bit about civil society engagement. Today's call is really about operations at the community level. What does vaccine rollout look like at community levels and national levels? And what role can we play in all of this? So next slide, please. We're going to go back to our regular format today, which means that we are going to start with, like I said, I'm going to provide a very quick overview of some of the AU mechanisms for civil society engagement, so that at least the information is there with us, even though we were not able to have them join us for today's call. Then we're going to look at operationalization of vaccine rollout at the country level, and we're going to have 3 speakers who are going to provide us brief overviews from 3 very different perspectives. Then we're going to have discussion, after which we're going to go into breakout groups. And the purpose of the breakout groups today is really going to be to process the information that we heard from the WHO last week and some of the other things that we hear today, and to see that now that we have this information, how do we strategize to play the roles that we see for ourselves? How do we engage with these bodies now that we know that these mechanisms are there? What kind of partnerships are needed? What kind of, relationships do we need to create to do that? What more information is needed? So all of that is going to happen in the breakout groups. And then we are going to end our final call for 2020. So everybody, please, as usual, stay muted unless you're speaking. During the discussion time, we will keep recognizing speakers. So if you want to speak, raise your hand, put a note in the chat box, and we will recognize speakers to speak. We will have ample time today for sharing, discussing, and strategizing, so please feel free to do that. Next slide, please. Okay, so the AU mechanisms. 1 second, please. Like I mentioned, they were not able to be here, but when we had a call with them, we suddenly recognized that I was not aware that the African Union Center for Disease Control has been trying recently to engage extensively with civil society. And we saw this with the WHO as well, because I think increasingly these bodies are recognizing that they can have the most foolproof plan that they believe possible to roll out vaccines, but it's not going to work if people are not going to accept the vaccine. And that acceptance is not going to come as part of the rollout plans that they are doing. That acceptance requires support from local civil society organizations, because we are the people on the ground. We are the people who communities trust. So increasingly, they have been trying to reach out to organizations and platforms to be able to understand what's going on. And what you see on the screen are just some of this. We've listed 6 mechanisms that the AU CDC currently has around vaccine rollout. And specifically, we were looking at AU CDC today because we know that a lot of people on this call are actually from Africa. So the rumor tracking system was really set up earlier this year when they recognized that what is happening is that not only are there extensive rumors about, and we've heard during our discussions on these calls about people believing it's a Western conspiracy, it's a political conspiracy, particular countries are sending people out, that the vaccines are chips being inserted into people or something to control them. We've heard all sorts of crazy rumors going around. But they've also been, and I think even in the last call, somebody mentioned a couple of local cures or things that they had heard about, and they wanted to know if they work or not. So what the rumor tracking system is doing is it's looking extensively at some of these misconceptions and misinformation, which it is collecting through different social media networks. And they are putting up information and reports on their website where you can actually see some of them. And my colleague is actually putting in a sample report, link to a sample report in the chat box. So you can actually see, it'll tell you what kind of rumors are there, if they work or they don't work. So if you want to figure out if there is a local cure that you hear about, or you hear something that's going around and you're not sure what's going on, or issues around vaccines or particular things, this is the place to go and find out what the status is. The other thing that they did was that in September this year, they began a vaccine perception survey. They carried it out in 5 countries, so South Africa, DRC, Gabon, Cote d'Ivoire, and Nigeria. And they did 4 weeks of surveying to collect data on what should their community engagement strategy be like. Now, currently, we do not have access to the survey information. We are trying to see if we can actually get this for movement members, and also to see if it's still open so that we can actually provide information on this. But this vaccine perception survey was essentially carried out for them to be able to define how they want to engage with communities, where the gaps are, and what roles can CSOs and community leaders play in changing people's perceptions around vaccine. This is also going to be the basis for a lot of the vaccine rollout strategy. So the third thing that they have is a vaccine development and access strategy, a region-wide strategy focused on preventing transmission, death, social and economic harm. And within this, they have something known as country-level community engagement working group. Again, I don't know if anybody on this call is part of any of these mechanisms. And if you are, and if you're engaging with them, please feel free to share more information about them during a discussion time. But we do know right now that there is a country-level community engagement working group which sits within the strategy. Okay, the next thing that we have is Africa Task Force for Coronavirus, or the AFTCOR. Now, this task force has 6 working groups. It is a multi-organizational task force. It is not sitting within the AUCDC. It has AUCDC, it has NGO people, it has people from UN entities, bilateral and multilateral entities, and this was set up in February. It is led by a steering committee that is chaired by the CDC, Africa CDC director. Now, one of the groups within this AFTCOR is the Risk Communication and Community Engagement Group. We have managed to, as of last week, get access for movement regional coordinators for this group, which means that our West, Eastern, and Southern Zone regional coordinators will now be a part of the Risk Communication and Community Engagement Working Group, which is again designed around this whole thing of COVID preparedness. How should the AU and national governments work with civil society to do this? So we will have more information on this, and hopefully the regional coordinators will be communicating this to you, but please get in touch with us if you want to learn more. And as and when we learn more information and we find avenues for you to engage directly with them, we will pass on this information. But for now, we have managed to get a seat at the table here to carry the voices from our communities. The last thing, and then I'm going to hand over very quickly, is the vaccine acceptability campaign. So the AU, for people who were on last call, you had seen this really complicated diagram that WHO had shared about what goes into people accepting vaccines. And it's not just about information or misinformation. There's this whole socio-cultural dimension to it. And recognizing that, AUCDC decided to actually create a vaccine acceptability campaign, which is going to be piloted in 3 countries, Nigeria, DRC, and South Africa. Unfortunately, they actually, or fortunately, I don't know, but they decided instead of getting civil society organizations to do it, they actually got a media firm, MNC Saatchi, to actually do this campaign strategy. But what we have managed to do is we've managed to connect at least our Nigeria chapter to them so that any kind of campaign is informed by what's happening on the ground. So that's really an overview of what kind of mechanisms exist within the AU. We wanted to share that so that we can decide and see in our strategy session how we are going to engage with some of these, and what can, how do we effectively divide our time and resources and energy to ensure that we are present in all of them and the voices are heard. So having done that, can I ask Izzy, could you launch the poll, please?
Yes. I'm still having those problems. Nelly, could you check on yours to see if it'll launch?
No problem. Hopefully you all see the first poll.
Can
Great,
you
I'm
see the
seeing
poll?
some responses. Yep.
Okay.
Great, we've got 13 responses. We have one more poll after this, so as soon as we can get a majority of you guys in there. 18 people. The questions are: one, were you aware of either WHO or AU/CDC engagement mechanisms before these calls? And so far, 84% of people are saying no, they were not aware of them. And the second question is, have you engaged with the AU, WHO, or your own government on vaccine rollout strategies? And again, 95% are saying they have not had that opportunity, or it's not been part of their work. So we have 20 responses. So I think we'll just move to the next poll.
Yes, please, Nelly. And we're kind of hoping that with getting some access to the WHO, to the AU, and hopefully we'll discuss this in the breakout group strategy session to some country level groups that have been established around this, we can change some of these responses and our engagement levels.
I've just put up the results for everyone to see for a moment before I launch the second poll. So we see 95% said no, 80% no on the first question. All right, and now the second poll. Hopefully you can all see that. The second poll, the first question is, do you feel prepared to engage in these WHO or African Union mechanisms? And if you don't feel prepared to engage, what are some of the reasons why not? And you can give multiple answers for why not. And if there's other reasons that aren't listed on here, please type them on the chat box.
So what we have managed to establish, at least with the WHO, is a connection wherein we will provide them with regular updates on what is happening in the field and what we are hearing as civil society organizations. Some of the challenges as the vaccine rollout and other stuff, and we will carry those reports to them. So all of this information that we're trying to collect is trying to build that report and what do we want to say. As we heard on the last call, we already have representatives from civil society organizations who are now part of some of the engagement structures, like Rashid's colleague Kader from Save the Children is part of the community engagement mechanism in the WHO. But we still want to collect as much information as we can and make sure that we carry that information to them.
We have 14 people responded so far. Maybe we'll just give it 10 more seconds to see if anyone else is able to. Okay, I'm going to go ahead and end the polling and share the results. Hopefully, can people see those results? It says we have 73% of 15 people said they don't feel prepared to engage yet. 4 people, 27% said they did. And of the reasons why not, a whole range. 7 people said they need more information. 6 people said I'm not sure how to access them. 5 said I'm not sure what to contribute. 7 said I'm not sure they will listen to us. Not sure that we trust them. And 2 people said there's other reasons, which if you're able to type those in the chat box, that would be great. And I'm going to stop sharing now.
Thank you so much, Nelly. So with that, so this is, like I said, this is something that we are hoping will change as we go forward with this and as we are able to establish some formal means of engagement with these bodies and make sure that we have different representatives from the movement, from different organizations in these bodies so that they can directly hear from us. So hopefully that will ensure that they listen to us a little more and we have a little more access. Now, I'm going to quickly move to our speakers. So we have 3 speakers today who are going to briefly touch upon operationalization at the country level and some of the issues from different perspectives. We're going to start with Rashid. Dr. Rashid Shah has been working for Save the Children in its Washington, D.C. office as Child Health Advisor in the Department of Global Health since 2013. A doctorate in public health, he has more than 25 years experience working in community-based MNCH programs and implementations, and has offered technical support to child health programs across a number of countries. So he's going to speak to us from the perspective of, of having seen so many of these other vaccine rollout programs. What can country level operationalization look at, some lessons and examples that we can learn from. So Rashid, over to you.
Thank you, Gunjan. Hi, everyone, and good morning, good afternoon, good evening, depending on which part of the world you are joining from. Can you hear me all? Am I audible?
Yes.
Yes? Okay, thank you. Because I was having trouble to hear all uninterrupted. I was having some internet issues here, but please, tell me if you cannot hear me, or if there is any issue. Probably I will stop video in that case to just make things more speed up. So the topic I will talk today about is a role of NGOs in vaccination program. From what we all know, to some extent, and from some of my experience I will share. And I believe, almost all of us here today in this call have, to some extent, familiarity of this topic. Although I was looking at the poll that many of us, we don't believe that we'll be heard. People will trust us, but I'm sure that we, in our works, in our belief, we know, the critical role of NGOs have in specifically in vaccination program. Almost all settings where we work, usually vaccine program is a public sector program and being governed and operated by the Ministry of Health. And GO-NGO collaboration has a critical role in vaccination program in a developing country setting, especially to fill up the resource gaps and need for enhanced technical assistance. These NGOs often facilitates Ministry of Health through close collaboration and resource sharing. In places where it is needed, Ministry of Health may assign the NGOs in several pocket areas or hard to reach areas, or in areas where Ministry of Health workers post is vacant and hiring is not possible or happening for various reasons. NGOs often operate vaccine sessions with NGOs health workers and offer vaccine delivery services in these areas. While vaccine supply, cold chain maintenance remain as the responsibility of Ministry of Health, NGOs usually offer support to deliver the immunization service to the population in these pocket and hard to reach areas. In the current context of COVID, when vaccine distribution and access to vaccine is becoming a huge issue, NGOs are taking a significant role to work together with the government and Ministry of Health to prepare the countries to ensure access, distribution, and delivery of vaccine for the population. In the forefront, at community level, NGOs often play their key role in community awareness raising, information sharing to reduce prevailing myths and misconceptions. We heard a lot from Gunjan in the slide before when she was talking about the rumor tracking planned by AUCDC. Like other vaccine in the program, in the community, there are a lot of myths and misconceptions and rumors. And we are hearing the similar kind of rumors and misconceptions in the community about COVID vaccine, which NGOs can address through their activities and community mobilization, community awareness raising activities. And NGOs can facilitate access to services. In the past, when I was working with the polio eradication program in the rural communities in Bangladesh, I saw community participation to support vaccine programs in several ways. I just want to share some of those with you, so that we can think on those. May not all of those be replicable or applicable to this scenario, but just considering similar situation in our upcoming COVID rollout plan. Community leaders and community volunteer groups, I saw them participating in local resource mobilization and supporting volunteers recruitment, orientation, and community surveillance activities. Vaccination Day, community members, religious leaders, teachers, they facilitated information sharing to the residents in their locality. They arranged local transport when it is needed, for whom the transport was a challenge for accessing the EPI sessions. From mosque, the Bangladesh is a Muslim predominant society, so mosques are very much common in every village. From the mosques, vaccination session location and information was announced by using hand mic. Many NGOs, they have a microcredit program and established community groups, which could be efficient platform to help community mobilization and awareness raising in the community. And similar to this microcredit platform, NGOs may have other activities, other programs where those platforms could be of use for COVID vaccine rollout and distribution scenario. And we can consider adapting those kind of plan for COVID vaccine. I like to share you an example from Kenya about how geo-NGO collaboration helped overcoming health service disruption in Kibra slum areas in Nairobi during the early months of this pandemic period. Save the Children International is implementing an immunization project in the informal settlement of Kibra sub-county in collaboration with Nairobi City County's Ministry of Health. The main objective is to reach every last child with immunization service in the area. Due to COVID, there was a considerable disruption of immunization services at the very beginning of the pandemic, as well as other essential services, thereby raising concern for outbreaks of vaccine preventable diseases in that community. So the Children partnered with local community, local government, and community-based organizations in the area and conducted door-to-door immunization outreach services in close collaboration with all the stakeholders, including community and local government, to immunize vulnerable children, as well as to locate, trace, and vaccinate every child. As
I am sorry to interrupt, but can you wind up in 30 seconds and then we can have more in the discussion? We can come back to this.
So when we are discussing COVID vaccine access, distribution, and delivery issues, there are few of the challenges we should consider. Countries in developing countries may not have access to the required amount of dose for the whole population. So priority setting and screening of the priority vaccine candidates is one prime issue where NGOs can play a significant role. There might be lack of human resource and technical capacity. Also, another important aspect is routine immunization program where we are familiar with to work. Contrasting to those routine immunization program, children for COVID is not the prime candidate. So because the children and pregnant women were not included in the research or vaccine trials, so efficacy and safety for those population are not yet evidence-based. So I will emphasize on extremely important role that NGOs can contribute in this context. And NGOs, community-based organizations have strength and potentials to be instrumental to facilitate government and Ministry of Health through sharing their experience, establish network and resource for each of these issues and challenges. I'm stopping here, and my sincere thanks to the organizer of the meeting for offering me the opportunity to join you today. And thank you all for your patient hearing.
Thank you, Rashid. And I'm sure we'll have more discussions coming up during the discussion as well as in the breakout groups. But we just want to make sure that we get to hear the speakers and have time for discussion. So Carrie Westgate is the Deputy Director at the Community Health Impact for Coalition, a field catalyst dedicated to making professionalized community health workers a global norm. She has previously worked for Deloitte, Living Goods, Live Well, Social Enterprise Zambia, and holds an MPH from Johns Hopkins Bloomberg School of Public Health. So Carrie is going to speak to us from the community health workers' perspective. What does vaccine rollout and operationalization really mean, and what do they need? Thank you, Carrie.
Thank you. Thank you so much, Gunjan and Dr. Rashid for sharing about the NGO experience in the vaccine rollout. It's my pleasure to be here today. Really excited to speak to this group. My name is Carrie Westgate. I'm the Deputy Director at the Community Health Impact Coalition. And today I'll be speaking briefly about the role of community health workers, known as CHWs, in the COVID-19 response, including the vaccine rollout, and what type of support community health workers need to succeed in their roles. And before I get started, on the next slide, I just wanted to give a brief background of the coalition. We are a field catalyst that is working to make professionalized community health workers a norm worldwide. And when we talk about professionalized health workers, we're referring to things like paying salaries, ensuring that community health workers are supervised, that they receive the training and the community support that they need to be successful. In fact, we have a list of principles that I'll speak to later around what professionalization means. But we work primarily through research and advocacy. We're a team of 17 implementing organizations and technical partners, radically collaborating to promote norm change around community health. And we believe strongly in making sure that community health workers are, as frontline workers in the COVID response, are getting the support that is needed from both civil society, governments, funders, and the broader international community. I'd just like to highlight on the next slide 3 general resources around community health. I suspect many of you on this call are working with or support community health workers, community health volunteers. And I just wanted to flag a few resources that we are really excited about as a coalition to help guide and optimize community health worker programs globally. So I would encourage you to check out these resources after the call. I'm happy to share any links or drop my email into the chat after this presentation if you'd like to know more about these tools. So why now? We have some general resources on community health. We know how important community health workers are to providing universal health care. But we know on slide 4, on our next slide, that frontline health workers during this pandemic have not been adequately supported. In fact, this is a direct quote from the recently published report on the state of commitment to UHC. And some of the findings that this report shared are just that COVID-19 has put immense pressure on frontline health workers, including community health workers. And we have seen shortcomings specifically in the number of health workers, the distribution of health workers, their levels of remuneration or pay, and the general inadequacy of resources available to support health workers in provision of services. And I just want to call out personal protective equipment, PPE. That is an area or topic that we have done a lot of work around as a coalition to ensure that community health workers are receiving personal protective equipment that they need to continue, not just interrupting the COVID-19 pandemic, but providing essential services as well. On the next slide, I just wanted to point out several resources that have speak to the growing evidence and advocacy around the role of community health workers in the COVID-19 response. Some with a coalition authored a paper on how community health workers can be involved and what support they need in this response. The WHO, UNICEF, IFRC have put out subsequent documentation and guidance documents to guide all of us as we think about how to best support community health workers in this kind of unprecedented crisis of pandemic proportion. So what does this mean as we think about the next chapter in this pandemic, specifically the vaccines? You know, as we look to 2021, we know that this will be a huge priority for all of us involved in global health and supporting community health workers. And as a coalition, we're in the process of finalizing and developing and finalizing some guidance around potential roles of community health workers at all stages of the vaccine rollout. They're listed here on this slide, and I just want to highlight that from the planning to identifying target populations for vaccination, outreach and education, mobilizing communities, administering vaccines, and reporting adverse events following immunization, there is a role for community health workers to play. And I would love to hear from all of you how you're envisioning communities and community health workers being involved at these different steps in the pandemic. I know I'm coming up on time and I want to leave plenty of time for questions and discussion. So my last slide for today, just a bit of a teaser to leave you with, are just some areas of support for community health workers as they are engaged at all stages of the pandemic response, and specifically the vaccine rollout. You'll see them listed here. This is based on the community health worker assessment and improvement matrix that I pointed out at the start of my presentation. But we do see, plenty of opportunity to make sure that community health workers are supported in these roles so that they can be successful in helping us reach target populations with the vaccine as and when that vaccine is ready. So I will conclude my presentation there. Thank you so much for letting me speak to all of you today. Happy to answer any questions and share resources as appropriate. Looks like there are already some things in the chat. So thank you all.
Thanks so much, Carrie. And everyone, if you have comments, questions, ideas as you hear the speakers or on this issue, please put them in the chat box and we'll come to them shortly. But now we're going to hear from Suhelia Basbaz, who is the founder and director of Community Cohesion and Social Innovation. She's also part of the Movement for Community-Led Development Mexico chapter. And I know that the president in Mexico announced the vaccine rollout plan yesterday. So it would be really interesting to hear from the country level, what is it that they are planning and strategizing about dealing with this. Suhelia.
Thank you very much. Gunjan, is that how you pronounce your name? Yeah. Okay, thank you. Thanks for the invitation. I am Suhaila. I direct a civil society organization called Community Cohesion and Social Innovation, which is part of the Mexican movement. And I will be commenting precisely on the national vaccination policy that was announced yesterday. I know my colleagues, Diana, Silvia, Mario, and Roberto are also here from the Mexican movement. So please feel free to add if I miss on some key elements in my presentation. I'm going to talk about the process and the result of that national vaccination policy and about what we know and what we do not know, even though we already had that announcement. In terms of the process of elaborating that national vaccination policy, we have information that it took around 3 months, and it implied the engagement of experts, primarily experts from the National Autonomous University, UNAM, and governmental entities and offices, mainly experts on health issues, at least taking into account official information. We do not have elements to think that they include social scientists, which is quite worrying in terms of the challenges of making people and communities have a higher chance to accept the vaccination. There is no evidence of public participation and deliberation, none whatsoever, nor, as far as I can tell, any mention of the role of civil society organization in rolling the vaccination. So the process itself is questionable from a human rights perspective. We do not have information and we did not have mechanisms and procedures to get involved in the discussions around this national vaccination policy. Now, in terms of the result and considering what we do know, because there are still a lot of questions unanswered, we know that the Mexican government wants the vaccination to be universal and free. However, we have not acquired enough vaccines for the 130 million people that inhabits our territory. We have around 34 million doses. We do not know how much they costed, which again is a violation of our right to information. This should be known by the citizens who provided the funds or the resources to acquire those doses. But we know they want this vaccination to be universal and free. However, we do not have enough doses. So there has to be some sort of prioritization in terms of who will access the vaccine before and who will access it later. And even though we do not have an official document that specifies all the key points of this national vaccination policy, we do know they want to prioritize two social groups. The first one is health workers or health personnel, which of course makes sense. And the second one is elderly people, starting with people above 80 years old, then 70, then 60, then 50, and then those above 40 years old. However, they consider the age as a criteria to prioritize elderly, but they are not taking into account other risk factors, such as comorbidity or mobility. So it may be that we are giving priority to an elderly person that requires the vaccine less than other person, for instance, someone with 30 years old that cannot stay at home and that is in contact with a lot of people. In the official information, it seems that children, youngsters, and teenagers are not a priority group, which is questionable from the point of view of the superior interest of childhood, but also in terms of the impact that children and teenagers have in whole families and communities. And we do not have information that they are developing a geographical prioritization. We only know that the first stage of vaccination that will cover health personnel will be focused on 2 states, in Mexico City and Coahuila, and we don't know why here and not somewhere else. And the following stages will be at national level, but there is no geographical prioritization, which does not make sense, because even though COVID has affected the whole country, it has not affected different states and cities and localities in the same way. And those places do not have the same hospital capacity to deal with serious patients. And we do not know either the role of military forces, and that is worrying because we are having an increasing role of the military forces in Mexico throughout the years, but in the recent ones, it's really worrying. They are in every single public issue. I'm nearly done, sorry. And we do not know either how will they tackle the major challenge of ensuring and warranting our right to information. There is no sense of a pedagogic process to increase the chances that people will accept the vaccination. And we have already failed in this when it came to prevention measures, so we cannot fail again with the vaccination. Thank you.
Thank you very much. I'm just going to jump in for time's sake and open it up to everyone for questions, comments, reflections. We will continue to chat about this in the breakout rooms. But unlike last time, this time, feel free to just raise your hand and bring any questions up directly. In the meantime, while we wait for people to absorb what they've just heard, also the speakers, feel free to ask questions to each other. I see Rashid has been doing that in the chat box, but also back to all the participants. One question to the group is, when in the poll, only one person said that they'd actually been able to engage with the AU or the WHO or their country government in strategies around vaccine rollout. I don't know if that person is still on the call and feels comfortable sharing, but if so, either in the chat box or out loud, it'd be interesting to hear about that. We also have a question that's come in from Sanyu. Do you want to go off mute and ask about digital technology? Are you there? I want to make sure, but she was put in here that she's curious to hear about how digital technology is being integrated into these discussions. Do any of you have a sense of that? Of the speakers?
I know, at least in the community health space, we are in touch with a number of technical partners, including Medic Mobile, Demagi, PreCelt, about a variety of technology tools that can be used to support tracking administration of immunizations, particularly in a multiple dose setting. And we're also looking at chat box functionality to help answer questions from the general public about vaccines. So a lot of conversations taking place. I'll see if I can share a couple of links in the chat in the next few minutes. So, but great question, and definitely something that is kind of integral to work around M&E as we think about community-based engagement and involvement of community health workers in vaccine rollout.
Yeah, and Carrie, you had a question to the group also about whether, no, of course I haven't lost it, but if anyone on this call is supporting community health workers in the COVID response and how they're preparing for the vaccine rollout. And to add to that, I'm curious if any of the people on the call who have been working directly with communities foresee any challenges that are particular to their community for the community health workers they have, or maybe there aren't enough. I mean, that could also be the challenge.
Hi, Nelly and Kerry. I mean, here is Rashid. So, I mean, from for our other projects in Save the Children, we have been working with Think MD group. I see, I mean, Kerry's presentation, Think MD logo. So I assume, I mean, they have also, I mean, work experience with them. They are one for-profit organization. They developed a software that called MedSync, and that is, I mean, meant for the frontline health workers. And during the pandemic, at the very beginning, ThinkMD actually, I mean, developed one screening tool, I mean, for being used by community health workers at the very initial level, at the point of care level, to screen out the positive, I mean, with symptoms, people with symptoms. So this is what one digital technology that I'm familiar with. I don't know, I mean, about others, but this kind of thing can help community health workers at some point. I have another question on the chat box for me. Suhaila, you asked me about children and women. Yes, I mean, for both the vaccines who disclosed their efficacy level and got approval, I know about Pfizer vaccine. They got approved by FDA yesterday or day before yesterday. And Moderna also, I mean, they disclosed their result of efficacy, and both of those vaccines were not actually, I mean, they didn't include children below 12 or 14 years. And also, I mean, pregnant women were not included in those trials. So for sure, I know, I mean, these two groups of population were not included. That's one big reason that safety and efficacy data are not available for these vaccines for these populations.
Thanks, Rashid. And Luke Barrier C, I see that you're putting in some comments. Do you want to go off mute and add your comments and question?
No, I think my comment speaks by itself. I mean, my concern on my question is that what I've heard right now is that civil society role in the delivery of vaccine and in a complementarity of the health system as they are. So I am wondering if there are experiences of people, of NGOs, working mainly or mostly on the demand side of the vaccine. So the involvement of community in the delivery of vaccine, how they can attract or pull the delivery of vaccine and ensure that services are provided in a way which is satisfactory for them, instead of being passive, being more active in this campaign there. So just a general question for the people who are there. I think CSOs and the civil society in general and NGOs which are working at community level are very well placed to increase that demand on services for better delivery services there of the vaccine, of the campaign there.
Yeah, absolutely. And I'm curious if any of the speakers or anyone in the audience has any reflections on that. We'll also we'll move into breakout rooms shortly. And that's one place where we'll be thinking about what our roles as part of CLD organizations can be very specifically, what strategies we can employ, absolutely thinking on both the demand and supply side, but that's a really good point. I also, maybe before we go back to the speakers or anybody have a response, Annette, I think you had your hand raised also.
Yes, I wanted to ask Rashid, actually, you had mentioned something about doctors in Nairobi and work that's being done there. It might not be the same, but it sounds like it is. A Congolese colleague had dialed in, and there were some doctors of epidemiology who were on the call, and they were expressed some lack of clarity with certain things. My main question is there research on another vaccine in Africa? He seemed to think there was something going on in Madagascar. The word of mouth over there is that to trust a vaccine, it needs to come from within Africa. Similar to the rumors, the misconceptions earlier of, well, this is a European or an American disease that doesn't apply to us. They want to know that a vaccine is going to work on them as Africans. So does anyone have any information on that? Please tell. You heard me, right? Yeah. Okay.
Yeah. So sure. Thank you. So you are asking about, the rumors, myths, and misconceptions about COVID vaccine, right?
Yes. Yes.
Yeah. I am aware about, a couple of those, as Gunjan mentioned at the very beginning. Like, these vaccines are coming with chips, and these will be tracking all those, developing world people. And but this is still, just yesterday UK they started vaccination in UK, and it is still, being discussed for distribution to the developing countries. I think, all the rumors are, in the media. Those are only what we are hearing all now. But similar to other vaccines, like, when we were working with other routine immunization program, we heard that these vaccines are coming from, this Western world, this people who are experimenting on us, and these are coming with the family planning to sterilizing us, all these myths and conceptions. I was working, m- basically, a long years in Bangladesh, and in rural communities, there are some areas where very religiously conservative areas, and those where, those religiously conservative areas, they were just, stopping accepting these our messages, anything like, newborn health or child health or vaccination, whatever we talk about. They said, you people are working with Hopkins in US, and you are against Muslims, so we are not accepting. So there are a number of statements that may come out of the community, based on the context of the local context,
Yeah,
so
Rashid, I'm sorry. I just wanted to clarify that this was specifically linked to a Nairobi webinar. Can you remind me again the name of that study that's going on in Nairobi?
it's not study, actually. We have been working in a program, the immunization program, for 3 years,
Okay.
starting this year. And our program is focused, our project area is in Nairobi, the Kibra slum, and so Nairobi County, Mandera County, and Wazir County. So it's a program for 3 years, and our aim is to reach every child, every last child, for reducing the zero dose children. So we have been working with the government on the service, on the supply side, as well as on the demand side, when we have been
Okay.
working in the community in collaboration with the community-based organizations and the
Okay.
community.
Thank you very much, Rashid. I'm gonna follow up with this with my contact to see if I can learn more about this Nairobi
Sure,
webinar.
and you can always,
Thanks.
communicate me. We can have offline discussions, and
Thank
I
you.
can share it.
Perfect.
Thank you.
So on that note, that was a great point about how the challenges, the concerns, the misconceptions, they will be different in different countries, different communities, et cetera. So that's a natural segue into the breakout groups, which we're going to go into in just a minute. This will be an opportunity to take everything that we've heard on the last call and on this call and think about how to apply that in our own work as community-led development organizations, so that we can be the strongest advocates and partners to communities in the vaccine rollout, and ensuring that there's equitable distribution, there's safe distribution, that there's the right information, that there's demand and supply. So we're going to specifically think about a couple of questions. What can we do? What are some of the specific strategies? And then also, what else do we need in order to do that? Do we need more information? Do we need more resources? Do we need stronger partnerships? Whatever it may be. We're going to have 25 minutes, a little bit shorter than usual. And when we come back, each group, we'll just have 3 groups today. We'll just take 1 minute and share 1 or 2 specific strategies that they discussed that either everyone in that group or a few or one organization within it can actually take. Facilitators and note takers, you all know who you are. Please remember to record and identify someone that can report back to the group.